I work in healthcare, and I want to bring some awareness to you guys about what the current politics and the state of our economy is doing to a lot of private practices and a lot of hospitals alike. So everyone's freaking out. No one has money.
Hello guys, welcome to my channel. My name is Alex, and today we're going to be talking about insane healthcare crisis. Why is a Band-Aid can cost like $700, you know? What do you think about that? It's pretty scary. Imagine you break your arm and the bill breaks your soul. In America, getting sick feels like a luxury you cannot afford. An ambulance ride, that's be $1,200 for the privilege or not dying. Need stitches? You better also need a second job. We do not have universal health care. We have surprise bills and GoFundMe. Go ER visit and suddenly your credit score needs therapy. Insurance, you pay monthly and still pay when you actually use it. Deductibles so high you'll basically uninsured until next year. Out of network, financial out of luck. Mental health care only if you rich or extremely lucky. We say healthcare system, but it's more like a corporate scavenger hunt. So this is what is going on, guys, and it's terrible. Okay guys, let's jump into the videos and watch, guys.
There's a public health crisis brewing that not many people are really aware of, and it's really only the physicians that are the boots on the ground working in underserved communities or in free clinics that really see this coming. And a lot of this is a fallout of the cuts in Medicaid and Medicare, as well as all the ICE raids that are going on. More and more patients are not coming to their clinic appointments to do their annual checkups, to get their minor medical problems taken care of, to get their prescription medications. And what's going to end up happening is that their small health problems are going to turn into very large ones, and ultimately they're going to be afraid to seek care until it's very, very late. And only when the severity of their illness or the pain from their condition outstrips the fear of being deported will they seek medical attention, probably in the way of going to the emergency department, which means that if you have a medical emergency and you need to go to the ER, it will be far more impacted than it is in this post-COVID era already. So in a year or two from now, when you go to the emergency department or you hear about how our health system is at a breaking point, think back on this moment and wonder how much of the current administration's policies may have played a role.
And what do you think about that, guys? Let me know in the comments below. He probably got the point. If the price is going to be much lower than it is right now, then people can do checkups and all this stuff every year, even every month. I don't think that this is a problem, and that it's a problem in the prices for sure. So let's check another video.
Given that we are on the Titanic, we are steering straight for a lack of subsidy iceberg, and Congress still could turn the ship to avoid that iceberg. What all should we be doing?
I would certainly be contacting your member of Congress, your representative, and both of your U.S. senators to extol them, to ask them to please extend these enhanced subsidies. Personally, I prefer they just be made permanent, but certainly extend them at least by a few years. And I would also contact your state representative, your state senator, and your governor, because there are some states which are trying to take measures to try and mitigate the damage.
Okay, guys. Yep. It's also pretty good advice. Contact your senators if you have any problems. Okay, let's go with another video. It's a pretty interesting one. Some statistic that probably gonna shock you. Okay, guys, let's dive into the video and watch.
Nursing today is in dire straits. It is one of the most high-risk careers in the United States. Listen to some of this information. It's ranked one of the top 5 jobs that people are leaving in the United States today. It's one of the top 10 most dangerous jobs according to multiple news and science surveys. 40% of nurses have high risk of long-term sick leave. And that's according to the Journal of Occupational Medicine. The average nurse over 35 years old is on 5 medications. They cite limited time off, swing shifts, understaffing, patient volumes, and high stress in the workplace. You can't make women work 12 hours and not be allowed adequate amounts of time to eat and drink water throughout the day. It leads to metabolism adaptations that slows their metabolism down, builds oxidative stress, causes reactive hyperglycemia. Now they're stressed, now they're tired, now they're using caffeine all the time. Nearly 40 to 55% of nurses, depending on what study you read, are overweight, and it is not from overeating. These women are underfed, overstressed, and they are some of the sickest in our community, and they are the people who are responsible for taking care of us. How in the hell can we count on a medical healthcare system that can't even take care of its own people and expect it to take care of us?
It's completely right. So nursing jobs is pretty hard, you know. I also been in the hospitals, and you know, I also had you know, have blessed with nurses that been with me, and you know, I can tell you this is a really hard job. Definitely, it's a really hard job, and you know, I just want to tell them thank you very much and God bless them. But they're doing a really hard job for sure. Definitely. Okay, you guys, let's jump in another video. You know, I'm trying to mix a lot of different videos from different states because I think it's gonna be pretty useful for our show. So I hope you enjoy that, guys. Okay, let's watch.
This is what's coming to you in them red states, whether you like it or not. 1 out of every 4 rural hospitals will be shut down. A lot of people work at these hospitals. They ain't got no jobs no more. Not to mention them shutting down also nursing homes. If you got people in a nursing home, guess what? He gonna be in the garage soon or in bed with you or somewhere, because they're gonna be shutting down nursing homes all over there.
J.D. Vance says you just need, you know, families need to come together and shoulder some of this.
You need to, yeah.
You need child care, get grandma.
Sure.
You need grandma care, just get the kids.
You ain't got no child care. Grandma may be a little, you know, needs to be in a special place, you know, where they're gonna shut down that special place so you can bring home Alzheimer's to look after your kids while you at work.
Can you just think about what they're doing to grandma's special place? Think about it.
I don't want to think about it.
Yeah. Yes, let me know in the comments below what do you think about it. And thank you very much for your like, share, subscribe. It's really important for me, guys, because I'm trying to grow this channel, and you know, I'm very happy and really appreciate if you're doing this. It really helps, especially if you sign up during the video. The algorithms of YouTube is thinking that this video is useful for you guys, and just, you know, show this video to other people that may be interested in it. And please sign up during the video, after the video. It's really important for me, guys. I do appreciate this. You know what I'm thinking here, guys? Some little thoughts, you know, just a little juice in this video. I'm just saying that they charge like $300 for Tylenol and call it standard. Imagine $300, and you didn't choose bankruptcy, you caught the flu. People skip treatment not because they want to, but because they want to eat this week. Dental and vision, low, those are now luxury services. I can tell you this for sure. I have done dental, and it was pretty expensive. Not all, but a little bit, you know. People in other countries hear this and think we're joking, you know. I have a lot of friends, you know, over the world and from Europe, and they just impressed of what kind of health Medicaid system we have here. They completely shocked. You want to compare plans? Better have a degree in ancient mathematics. Some folks go to Mexico just to get prescription without selling a kidney. We're the only country where do I call an ambulance is a serious financial debate. Healthcare is now a gamble wrapped in a paperwork. You either have a great coverage or great anxiety. It's not about getting better, it's about not going broke while trying. This isn't just a crisis, it's a national embarrassment, and we are all one hospital visit away from losing everything. I can tell you this for sure. So let's dive into another video, guys, and watch.
The U.S. healthcare system is completely fucked, and I'm going to give you one example why. Last night, I was giving a lecture to a group of very inquisitive, intelligent, and educated women, all about menopause, perimenopause, and treatments. And so, inevitably, the personal stories of these women always come out. And one lady told me a story of how she went into menopause about 2 years ago, went to her doctor, was prescribed estrogen and progesterone, but was given instructions to stop after 21 days and instructed that she should get her period at that point. So not knowing any of her medical details, I'm not really sure why she was told this. That's not standard. But nonetheless, she took the hormone therapy, went off it in 21 days, and didn't get her period, probably because she was in menopause. But this obviously scared her and concerned her because she was expecting a bleed. And when she tried to get in touch with her physician 3 times, those calls went unanswered. And when she tried to make an appointment to get in with her physician, the next available appointment was between 6 and 9 months. So out of fear from not getting a period, without the education she needed, she just went off her hormone therapy and then was basically afraid to ever go back on it because she didn't get any clarification or any education at her initial visit and when she tried to follow up. And I don't blame the patients, and I definitely don't blame the doctors. I was in that system. I know how overburdened we all are, how we're being forced to see patients every 10 minutes, every 15 minutes, every 7.5 minutes when they want to double book us. And we just aren't being given the time and the resources to give good patient care. And this is a sad thing because every doctor wants to feel like a good doctor and they want to give good patient care and they want to give you your time. But we're not being allowed to do that under this current system anymore. So patients are dissatisfied, doctors are dissatisfied, they're leaving in droves. In my area now, it's between 6 and 12 months to get an appointment with a gynecologist. I had women in that class last night that want to go on hormone replacement therapy, or at least want to have the conversation, and they can't even get in with a gynecologist for 6 to 9 months. So they have to suffer. We have to do better. The system is coming to a total crisis. I wish all the doctors could basically just unionize and revolt and duck out of the insurance mafia, forcing change. But I think we're a ways off from that. But anyway, I'm sorry for all the patients out there suffering, and I'm sorry for all the doctors who are suffering along with them.
Yeah, definitely, I agree with this lady. You know, what do you think about that? Let me know in the comments below, guys. Let's jump into another video.
That hospitals closing because of Medicaid cuts is just a Democratic scare tactic. But here's what I know. My cousin is a health professional at a hospital in Indiana, and her hospital is on the list of facilities that could shut down if these Medicaid cuts go through. This is not hypothetical. This is her job and the people she works with in a community that may lose access to care. Across Indiana, hospitals are already cutting back. Columbus Regional Health just laid off staff and shut down its rehab unit. Medicaid already underpays. These new cuts would push many facilities into the red. If you think this is a lie, talk to the people who are living it, the hospital workers, the families, the rural communities already watching services disappear. The people calling this a hoax won't be the ones driving 90 minutes for emergency care. We can argue politics all day, but when your hospital closes, it won't matter who you voted for. And no, we won't say sorry for raising the alarm. We'll keep fighting to protect the people who actually need care before it's too late.
Yeah, I decided to show you this video because, you know, we have another side of the medal when the big hospitals is closing down, you know. And this is what is going on here. Let's jump into the next video, guys, and watch.
Hi everyone, this is Cambria here, and I want to talk to you about the developing healthcare crisis that could impact thousands, patients and healthcare professionals alike. Northern Light Health, one of Maine's largest health systems, just announced that major service changes are coming. They're not closing any hospitals yet, but don't let that lull you into a false sense of security. What they are currently doing is evaluating their workforce and leadership structure and looking for ways to maximize revenue. That usually means layoffs, consolidated departments, and fewer services available, especially in rural areas. So let's talk numbers. Northern Light reported a $156 million loss in 2024. That's on top of nearly $617 million in debt, up significantly from the $445 million they carried just 1 year earlier. So this isn't just a one-time hit. Their credit rating has been steadily dropping, which affects their ability to borrow, grow, and recover. And it's not just money. The president of Northern Light Acadia stepped down in June, just the latest in a series of leadership departures. Behind the scenes, they're dealing with the same issues many health systems are currently struggling with. Skyrocketing costs for supplies, pharmaceuticals, and labor, fewer patients coming in post-COVID, and insurance companies denying more claims than ever. But here's where it gets even more concerning. A federal Medicaid overhaul, which we all know now as the big, beautiful bill, is hanging in the balance. If it is passed this week, it could gut Medicaid reimbursements. Even Senator Susan Collins has raised alarms. If that bill passes the Senate and the House and goes to the president's desk, health systems like Northern Light, already on life support, will have to cut even deeper. So let me be clear. This is about more than just financial restructuring. These cuts will directly affect access to care. Fewer services at local hospitals mean longer wait times, farther distances to travel, and more strain on the healthcare workers that are still standing. So if you're a nurse, a patient, a caregiver, or even a policymaker, don't wait for a press release about a facility closure. This is the warning. The time to ask questions, speak up, and demand transparency is absolutely right now.
Yeah, you see, I found this video, but as we already know, the big beautiful bill is already passed the Senate and the president already signed it. So it's already this all changes already take place. So I hope everything's gonna be okay with this. But let me know in the comments below what do you think about that, how it affect your areas. Okay. So guys, let's dive and watch another video. So
I posted a video about the issues that my sister is facing, how she was incarcerated, how she has many mental health problems, etc. And in that video, I never once said she should not go to jail for her crimes. I did say she should receive appropriate mental health treatment and appropriate medical treatment, which, by the way, the state of Florida has failed her. She has been incarcerated now for 6 months, and she has not received the treatment she needs. She absolutely has not. So I'm putting Florida on blast. This is crazy. Every time I call that facility, Ocala Women's Reception Facility, I leave a voicemail. I get a voicemail. I leave these messages. I ask to talk to people. I ask to talk about her health care. Nothing. Nothing happens at all. Either way, back to the point of this video is this gentleman, a dentist, decided to teach me how psychiatric disorders worked and how psychiatric medications worked, like I'm unaware. I'm aware. Thank you. And also, I suggested that maybe people with these issues should be subjected to potential court-ordered mental health treatment and mental health medications and long-term injectables like some states do. What do you guys think? Is that crazy? It seems to work in some places. Not all states offer it. But also, if you guys know anyone with the Florida Department of Corrections and can help my sister get some medical treatment for some illnesses that are very real and affecting her, let me know. I honestly, I can't even find the people who are providing care to her to like file a medical complaint to the board.
Yeah, it's terrible, guys. You know, it's also depend from the state where exactly she can get a better treatment. You know, if she were in another state, as I understand from Florida, she probably can have a better treatment. Let me know in the comments below, like, what do you think about that? Okay, guys, let us check one more video, guys, and I think it's gonna be a pretty interesting one too.
So over the last 6 or 7 months, I've been in and out of the healthcare system, and it has become acutely aware to me that healthcare is in crisis. Over 40% of nurses say that they're going to leave the system by 2029, and the American Medical Association says that there is 1 physician suicide on a daily basis. The stresses of healthcare can break you. I know. I left healthcare after being diagnosed with fibromyalgia and chronic fatigue. And once you're out of that system, you're discarded. You have to figure things out on your own. Not only are toxic work cultures prevalent, but we're encouraged to delay rest. You don't always get proper nutrition or breaks. So just a warning, when you break from the pressure that you're putting on your body, when you break because you're trying to conform to that system, there's no safety net for you.
What do you think about that, guys? Let me know in the comments below. I decided to add one more video here, you know, because I thought it will be very useful here. So let's dive in and watch one more video, guys, please.
Interior Health is shutting down pediatric care in Kelowna for kids for 6 weeks. That's right, starting on the 26th, according to Interior Health, they're going to need to shut down the inpatient pediatric unit in Kelowna because of staffing shortages. This is what happens when you have a healthcare system that is absolutely crumbling, falling apart at the seams, is just not working. This isn't a one-off. This is a systematic failure of a system that is supposed to be there when we need it. And it's incredibly disheartening because we have people right now that are terrified about what they are going to do if their kids need inpatient help for the next 6 weeks. Are they going to have to go to Kamloops? Are they going to have to go to Vernon? Is Vernon going to get too full and they're going to have to send them somewhere else? Kamloops is already chock-a-block. The problem is the NDP government here in BC, they're just turning a blind eye to this. They're essentially saying, well, there's nothing to see here. Everything's going to be fine. Don't worry. We still have the ER open. And if you need to run to an ER to get some help, someone can help you out. The problem is this creates nothing but anxiety for parents who are thinking, what happens if my kid needs help? And you have to remember, a lot of parents are dual income families who are working their butts off because of how expensive things are. So it's not like a parent can just easily drop everything and rush their kid to Vernon or rush their kid to Kamloops because they need some kind of inpatient help at the pediatric unit. It's completely unacceptable. We've seen so many rural ER closures. Lillooet has had 30 ER closures this year, and it's not even June yet. So healthcare is really teetering on the edge in British Columbia, which makes me ask the question, do you trust BC's healthcare system? Do you still have faith that if you need it, BC healthcare will be there for you?
Yeah, it's pretty interesting, guys. You know, I definitely agree with the gentleman. It's terrible going on here, and you know, it's the most interesting fact. A lot of hospitals are just closing. Let me know what is happening in your areas. I will be very happy to read about that in the comments. And I'm done for today, guys. I hope you enjoyed this video, and we will see you in the next episode. Be safe, guys, and bye-bye.